The International Clinical Council is a body of medical experts in the management of FOP. These experts came together in 2017. It's a there is no sort of industry support for this organisation, and the role of the group is to examine the clinical management and for patients with FOP to ensure best practice, and also to ensure best practice in medical research. The team of doctors is taken from all over the world, covering all continents. We have experts in adult and paediatric care, and we cover all the continents of the world, so that again the hope is that any patient worldwide can get access to the expert care of one individual, but can also then pool on the resources from the wider group. The most important part of the work that we've undertaken so far has been updating the consensus guidelines on the management, or the medical management of FOP. This guideline was published early in 2019 and then updated a few months later based on some new recommendations regarding immunisations, again, which is an important aspect of medical care for patients with FOP. And these guidelines are available on the internet. They're available on the IFOP website and also on the ICC website. And they can be made available to clinicians, both expert and non-expert, who look after patients with FOP, and also to patients themselves, so that they can have access to these guidelines and again share them with their primary care physicians. And this is really important to ensure that all patients have access to the best sort of care based on the best evidence that there is at that particular time. This document again has reviewed the clinical data that was available at the time of the report being prepared. We've looked at the clinical and the basic science. We've looked at sort of lots of the various aspects that could be involved in particular aspects of the individual care. What's important, however, is that although this document is comprehensive and it gives relevant clinical information, that then has to be applied to the particular patient that a doctor is actually seeing. And there may be lots of other particular healthcare issues that need to be taken into account. So this should give a framework for how the patients are managed. It doesn't dictate exact management, but it does give what would be deemed to be best practice based on the best available evidence at the time.